Okay. So the air disorder. Usually, what are the people complaining when they are coming to your pharmacy complaining about air? About their air. What they are complaining from? They complaining about from pain. Yes. What else?
They are not hearing well.
They are not hearing well. Okay, they are not hearing well. What else?
Liquid coming before they...
The liquid. There is a discharge coming. Okay, there is wax. Okay, what else? There is itchy and fungal infection maybe in the external air. And then there is otitis media. There is anything else? There is the imbalance which is vertigo. Okay. Do we have anything else? Let's discuss one by one. If I came to you, I have excess wax. I have wax, and I came to you, I need something to relieve the wax. What usually you are giving?
Sodium glucosamate.
What?
Sodium glucosamate. D-wax or...
In D-wax, what we have in the market, we have only the D-wax. You are giving him the D-wax and that's it, right?
For 2 days, only for 2 days.
And after that?
Not more than 2 days.
Why?
Because the wax is the normal ingredient of the, or normal barrier of the air. If you use it more than that, you will expose the air for...
Yeah, that's why, because the wax, it's the physical barrier, okay? So it will prevent anything to go inside. So when I give something to remove the wax, I need to give at the same time something as an antibacterial, because while I'm removing the wax, there is a susceptibility that it could be infected. So usually all the people with the doctors, when they describe anything to remove the wax, they add something like Oflox, something like ciprofloxacin, HCC, something as an antibiotic air drops. You have in the market something like D-wax, that's it, right? Only D-wax. But do you know that they can wash it? They can wash it with the sodium bicarbonate. You have the urine sachet. You can put it in water. You can have a syringe or water or cotton, and just you can have it. You can have it for 1 hour, and it will give an effect better than the D-wax. Do you know that while at night you can ask your patient that bring a cotton, just a small cotton, put an olive oil and put it in your ear while overnight, and then while you are waking up, you will find, when you are moving, you will find all the wax, it goes out. So it's not only the D-wax. You have the D-wax and you have other solution you can inform your patient about it. Okay? So this will be the air wax. I'll give D-wax a drop. You can put even the D-wax in a cotton and insert the cotton inside, or olive oil as I discussed. Whenever you are giving a D-wax, you need to give something like an antibiotic, like Oflox or ciprofloxacin, to protect from any infection. It makes sense? Please advise your patient about sodium or bicarbonate. It will give effect. Really, it will give amazing effect. The second thing I have, usually the people they have the complaining of, let's say, otitis media. Otitis media, how I know that there is an otitis media? There is a fever, there is a pain, and if you just check this area back to the air and you try to press it, the people they cannot stand it. So immediately you feel that there is a pain. There is a pain back of the pain. And this is how the people and how the mother they know that when the kids they have otitis media. This is most common between the kids, right, and children. Usually what we are giving, you need to give something as an antibacterial and something to relieve the pain, and you can give something like something local to relieve the pain as well. What we have to relieve the pain? Maxigesic, but drops. Titocin, only what we have in the market, it's only titocin, right? So we'll give something to air pain, the fever, and discharge. This is from the otitis media. You'll find that the white or the yellow discharge coming out. So that time, and there is a pain, so immediately this is an otitis media. You give Supropain, you need to give something like antibiotic air drops. You need to give Cetil 500 as again as an antibiotic and maxigesic to relieve the pain. You can give titocin as well. Okay, so this is the otitis media. We have some people, they came to you, they have on the outer air, you find that there is a scales and there is an infection. Anybody faced it?
But only the quiet?
No. Have you seen this case before? You find it only here. There will be the infection in this area and around the air. You find the scales, and it will be some people, they have abscess in this area. Abscess, and sometimes it causes dryness. Some people they have even eczema in this area, but it got infected. لا مش ورا قدام من جوه. اللي ورا مالها؟ هنا بتبقى تحت، بتبقى في الجفاف، بتبقى جفاف او انفكتد، لكن انا بتكلم على الاوتر. تمام. Usually what we are giving. You need to give something. You can give something with which you can give something for sure. You need to give something to protect the air from getting infection as a precaution. You can give leukoid cream, and you can give allergican. You have the allergican, allergican, the tube one for the eyelid. You can usually use it for the air to protect, as it has something work even in a state of leukoid, and you need to give something as maxigesic. When you have an otitis media or external otitis, you should not allow water to go inside.
كان ستين دروبس يا دكتور.
لو هي fungal infection، لو في smell.
في الأغلب بتبقى فيها fungal.
لو في smell, if there is a smell, so it will be a fungal infection. You need to give something as a canesten or something work as fungal infection. You know how to differentiate. This is what I want. Okay, when you add something, we tackle it. Okay, so all what I discuss, when it's due to a trauma or tumors or it's an infected. Sometimes it's fungal infection. When it's fungal infection, you need to give something as antifungal. Okay, so then the furnicles. You know what is furnicles? You know the abscess and then boils and then furnicle. اللي هو الخراج بالعربي. Right? Some people, they have the abscess inside or outside. When it's inside, you need to give antibacterial cream. Like ophthalmic drops, you can use it, and for sure you need to give an antibacterial tablet, and with the warm compresses. Why we use the warm compresses? Yeah. أول حاجة بتخليها تجمع، أوكي، بعدين تفتح، فإيفن it's easy to be cleaned and easy for the treatment to reach the site. Okay, vertigo, loss of equilibrium. Usually the people who are suffering from vertigo, what they will have? Loss of equilibrium, just suddenly they will faint down. So, okay, usually those people, they will be a prescription. They will not come to you usually. In case they came to you, give the beta circ, the drug of choice. It's a beta circ and vitamin B6. Beta circ and vitamin B6. I don't have a vitamin B6 in my product right now as a vitamin B6, so I give a magnesium. I give Magvita, so it's a magnesium with a vitamin B6. What we have, اللي هو الطنين, tinnitus. You will feel that there is a ring in your ear. What you will give? Sometimes, yes. Usually, كم ممكن تقولها في المايك؟ خذ المايك، يس.
هو في الأول التينايتس ده ممكن يكون سببه أصلا في هايبرتنشن، يعني المريض أصلا بسبب الهايبرتنشن ففي هاي بالس عنده في الودان، فبنتشيك الأول البلاد بريشر بتاعه هل هو عالي ولا لأ. لو عالي خلاص هو المفروض بيتابع مع حد دكتور.
So you refer him to a doctor. Refer. So if it is not, you will give the normal something to relieve the pain and titocin, something to. You will check also if he has a wax, if he has any discharge, and then you will try to solve the problem. Thank you. شكرا. Right now, do we cover all the air disorders? or the air problems. So we cover the tinnitus, we cover the vertigo, we cover the furnicles, the external air, the otitis media. What else? And the earwax. So in any case, the people will come to you in the pharmacy, you could be able to help them, right? Interesting. We will talk right now about the eye infection. Okay, usually the eye infection, what the people they will come complaining about their eye. What will be the usually red eye? Okay, itchiness and dryness. The secretion, or there is discharge, right? What else?
Dryness.
Usually dryness. Okay, some people they will come that they have hair, they have eyelashes fall, right?
Yes. Pressure, eye pressure.
They have the eye, they cannot stand for the pressure in the eye. Anything else that could come to you in the pharmacy? Okay, that he will do refill for that treatment. But okay, let's speak about the cases which we consider it as an OTC. Okay, the first case we will have the eye infection. The eye got infected. Okay, infections means it's bacterial infection, mainly. Bacterial infection, so what will be the symptoms? The symptoms will be red eye, there is a discharge, sometimes there is a tear. Okay, so the discharge, you will find it mainly when you wake up in the morning. Right? In some cases, you will find it's swollen. Type. How can I treat it? First, I need to clean the eye. I need to give something, I need to clean the eye. So usually in all the treatment for the eye, I need to use hot compresses. I need to use, how I can use the hot compresses? Usually I will put a hot towel and I will do a massage from inside to outside for 5 minutes before using the eye drops. Yes, Muhammad? Okay, so the hot compresses, as I said, it will clean and remove any dirt, and it will allow the medicine to penetrate more, so it will give me the result better. So what can be my treatment? First, I will do the hot compresses, and then the treatment I could give something like Maxitrol and fucithalmic. Usually in all the treatment, you find that usually in my treatment I used a medication which can cover broad spectrum. So in Maxitrol you will have I think Plomyxine, Neomycin, right? Plus dexamethasone, and adding to that fucithalmic drops at night. So in that way I ensure that the patient, whatever was the bacteria, I have something to work on it. But I hate ointment, and instead of giving ointment, I'm giving the viscous drops, which is the fucithalmic. So the fucithalmic before bed he can use it, and in the morning time I can use Maxitrol, something with why I add dexamethasone. Usually, as we said, there is an itchiness, and there is a redness, so I need to clear this. طيب a treatment عندي أنا have a Maxitrol, and I have something at night as viscous drop. Instead of the ointment, I will give fucithalmic drops, hot compresses. And if I wanted to add on to this, what I can add on? Like, need smart people, yeah? Omega-3, it will come in the next. But I cannot give, I can give the wash, right? The Optrex wash. Use the wash and then put it in your eye, and then it will clean and hydrate the eye, right? It could be an add-on, and usually all the time they like to use it because there is a dryness. And corticosteroid, even it causes dryness. Okay? Make sense? Okay.
Any chance to use the Tonimer single dose?
You can use it, Tonimer single dose for sure for cleaning. Yes, for sure. It's even better. Okay? Type, blepharitis. Okay, first eye infection, it's covered. Right? Right now you can, if we use it in the role play, you can count me on it, right? Okay, the second thing will be blepharitis. What is blepharitis? I will give you a case. I came to you in a pharmacy and I complained that I have a dryness. I use all the time to scratch my eye, and all the time I feel that it's dry. And I have used cysteine, I have used Artilac, and it works for 2 days, and then I have the same conditions again. What you will give me? What cortisone? I have a dryness. Cortisone will increase it, will induce even dryness. Even I have a dryness, and I'm using the medication which treat the dryness, and it didn't work. Could be inflammations. I was one of the people who has this case, and after 2 months I discovered that I have a blepharitis. What is blepharitis and how did I know about it? Just one thing. When I wake up in the morning, that I will find crusty discharge, not in the eye, on the lashes. So what will happen? You'll find it's very minimal. Just when you do it, you will not feel it. When you wake in the morning, when you do this way, you'll find a little bit on the lashes, and you'll find it caused the lashes fall. So you will find the crusty discharge on the lashes. And you have a dryness, in this way it's blepharitis. Blepharitis, it could be caused by 2 things, whether it's bacterial infection, or it's seborrheic dermatitis. Okay, how could be seborrheic dermatitis? If you have seborrheic dermatitis in the scalp, it could reach to the eye, and then you will not feel it, because in the morning time you will feel that there is something, so you think that it's from your scalp. For blepharitis, you will have the crusty discharge on the lashes. On what? The lashes. What will be my treatment? Okay, the symptoms will be crusty discharge on the lashes, especially when first waking. The symptoms again, it's a dry eye, itchiness, loss of eye, lashes, and photophobia. Usually the people, you will not feel the photophobia because we have the sun, so the people, they think that I'm normal. But the rest, I have dry eye and the itching, so usually I'm running for the cysteine or Artilac. Use it every day and it will be fine. Use it for some times and still I have the problem. But just ask, when you are working in the morning, or just, if you don't know, just check today. When you wake up tomorrow, just to check if there is discharge or not. Okay? Then the treatment, warm compresses for cleaning and softening, help to encourage how of the oil, يبدأ الأويل يطلع. فده when you encourage the oil, فده it will increase or it enhance or remove the dryness. Okay, decrease the dryness. What will be the treatment? The treatment, Topradix, I can give lipostic gel. I can give, if it is seborrheic dermatitis, I should use something like Cibizole shampoo. How I use Cibizole shampoo? Cibizole shampoo, when I use it as a seborrheic or antifungal, I'm using it without dilution. So I'm using it I'm just using as a lotion. And with my eye, I need to put it on my ear and my eyebrow, and that's leave it for some time and then wash it. Okay? With this Topradix, you can give lipostic gel, you can give Artilac Advance, you can give whatever the things to work on the dryness. The add-on here will be omega-3. They found that omega-3 regulate the gland secretion, especially the one in the eye. So it helps in the moisturizing.
ممكن ازودها في كل الفايبر.
You can. لأن هي بتزود الجلاند. Help the proper function and regulation of the eyelid glands. Usually they found that إن هي ليها anti-inflammatory, and I can add on as well the eye wash, and I can add usually what we have for the lashes. Try to connect. Some people they came complaining about loss of the eyelashes, especially women. So don't leave the chance. So, what we have for the eyelashes too? We have rabbit lash. We have what else? Probably. Thank you. Lomigan. Lomigan. How do you use Lomigan? Okay, you can use Lomigan. Lomigan, you can put the drops. They found one of the side effects of the Lomigan, improve the eyelashes or increase the eyelashes. So how to use it? Put it on the mascara, or you can do it on the only on the lashes.
If the eye is colored, you can't use it because it darkens the eye lid. And don't use it maximum 14 weeks every day. After that, you have to use it twice a week or thrice a week.
لا هو it will not be for a long time. You just حاجة كده, just once, يعني 1 week or something, and let's leave it. يعني something to do the rebalance again. And you have the castor oil, you have the olive oil, you can castor oil for the lashes at work. Then again, while you are propping with the customer, or while you are talking with the customer, you could tackle everything. So I will work on the blepharitis, Topradex and lipoxy gel or Artilac. I will work on the eyelashes with the Lomigan or castor oil. Then I will work with the hydration with giving an omega-3. So at the end, the customer, he took what he need, and at the same time I achieved my goal. Make sense? Okay. So do you know about blepharitis before? Okay. The pink eye usually conjunctivitis, right? Usually in the people where they have foreigners, they will come. I have a conjunctivitis. I need something. It's eye. What are the symptoms? Watery eye, accompanied with the discharge. The infection usually affect one eye. There is a swelling and there is a severe pain. Usually you will find that there is a severe pain and the people will go directly to the doctor when it's viral. When it's a viral infection, so they will feel the burning sensation. They will feel there is a burning in the eye. It will be a full red. And then there is a discharge swallow, and there is tearing, and it's really painful. Usually, what is the difference between eye infection and the conjunctivitis? The pain. You can differentiate, and based on the pain strength, you can say that whether it's bacterial or whether it's viral infection. Type. If it is bacterial, we know that what we can give, we give 2 bricks. We can give a behest, something to remove the congestion, or we can give something with a corticosteroid. If it is viral, anybody has the Paraxet drops? The pharmacy? I think it was out of stock. So it's out of stock. All the people they are searching about it, but it's not available. You see, look to this picture. You'll find the picture here. You see the blepharitis. This is the normal, and this is the crusty discharge. Usually, it will not. This thing. If you just massage it, it will go. You will not feel it. That's why many people, many customers, and many pharmacists, they could not diagnose it in the right way. Type. Trachoma. Trachoma caused by chlamydia. What is chlamydia? Bacteria. That's sexual transmitted. The cause sexual transmitted. One of the causes of sexual transmitted disease. How it reached to my eye. Usually in the poor countries and in the poor hygiene, when there is no proper hygiene, it's there. How can I know that it's a trachoma? The people who work in أماكن شعبية, usually the people will come to you, they will tell you that, Doctor, I feel that there is a sand in my eye. So أنا حاسس إن في sand in my eye, it's moving. صح؟ and then you don't know, there is no sand, there is nothing. What is there? It's something which call follicular. It's like a small ulcer. If you just open the eyelid, you will find an ulcer, small ulcer. While the eye secretion is smooth, he felt that there is a sand move in his eye. So how to treat it? When you treat it, please give whatever you have in the pharmacy. Okay? Usually لو if you give I used to give التوبريدكس مع التوبريدكس ماكسيترول كنت بدي الفيوسيثالميك. In this way I covered يعني لو كانت whatever the things it will move. After the hot compresses يعني after the wash, you need to use something to wash the eye because I need to reach to the ulcer from inside. Usually it will show this. It's not showing here, but usually it's an ulcer from inside. If you remove the eyelid, you find an ulcer inside. So this is called trachoma. So we can now differentiate between trachoma and conjunctivitis and eye infection and blepharitis, whether it's blepharitis, whether it's sporic or bacteria. What we missed here, the eye style. What is the eye style? Usually when you have the eyelashes, when it goes, one of the pores got infected by Staphylococcus microorganism. When it got infected, it starts with an abscess. It will be in this way. Then later on, if you leave it, it will be big. Okay? How to treat it? Simply, as we treat the furnicle in the eye, we need to hot compresses for some times to open it and to remove the excess. You can give for the eye as a precaution, and fusitalmic for the eye, for the eyelid and eye wash. You will never get rid of it unless you do strong warm compresses. When you use the compresses, just press, use your pressure on it and use it from inside to outside. Use it from inside to outside. And the same day you will find it will be bigger. And then the second day you will find it's not there. Is it fine? Type. Do we cover in this way the eye infection? حسب الستاين انت ممكن تدي سيستميك انتبيوتيك لان هو اني ستافيلوكوكس بكتيريا ستاين بتشتغل لا مش برا دي هنا في الايلid من جوه يس. طيب when you give a treatment for any eye, if I have infected one eye, you need to give a treatment for both eyes. تمام. So don't do the mistake of giving the treatment for one eye. You need to give the treatment for both eyes. لو عندك if you have 3 eyes, you need to give. طيب. Right now we finish the eye infection.